Earlier this week, a St. Luke's doctor who has been letting the public know how his health system has been handling the Delta surge of COVID-19 has been keeping us updated on the record number of patients, the ICU numbers, how many unvaccinated. Well, on Monday, he tweeted out 300 plus COVID patients, and all of them in the St. Luke's health system in the ICU there were unvaccinated. About 45 minutes later, Representative Greg Chaney from Caldwell retweeted Dr. Cavanaugh with this: "My mother passed away last Monday from COVID-19 in the ICU. Being unvaccinated was her choice. But those making that choice don't just put themselves at risk, they strain their families and place non-COVID patients at risk by diverting care. Please get vaccinated," he said. It got a lot of people's attention, including ours. Representative Chaney told us his mom, Judy Page, was 74 years old and was living with his sister, who is also unvaccinated. Well, she and her husband contracted coronavirus, and a couple of days later, his mom, Judy, became ill. That was around Monday, September 13th. By Saturday evening, Judy was disoriented and sick enough to be taken to West Valley Medical Center's emergency department, where she was admitted to the ICU hours later. It took a couple of days to get her there because at first she didn't want to go because of, misinformation she's read about crisis standards of care. Monday, Representative Chaney spent in court doing his day job as a lawyer. By that afternoon, things were looking up for his mom until they weren't. By Monday evening, doctors doing all they could do were giving her morphine and not much of a chance. Chaney said he made it to the hospital by 7:15 that evening, and by 7:30, his mom Judy had passed away. His mom's story, his family's story, is not unique in Idaho. A conservative family sharing a conservative upbringing, but they don't share the same outlook on healthcare or the pandemic. Representative Chaney says his mom was skeptical from the beginning.
I think that she was skeptical about whether it was really as bad as it was billed to be. I think she kind of viewed it as, hey, I've been through a lot of stuff in my time on this planet, and this is just another thing in the stuff box.
So, like a lot of families, I'm sure, in Idaho, I mean, there are factions. There's split. There's a holistic side, as you're mentioning, and then there's those that kind of go with the traditional Main Street kind of medicine.
Right.
That's your family.
That's my family, absolutely. Opinions as broad and diverse as they can be. And I think there was a natural skepticism. She wasn't gullible, and that's, I guess, one thing that I've tried to make clear is, I mean, she was the first in her family to graduate with a bachelor's degree. She got a master's degree. So she was an intelligent person who, she made her own decision. It was her decision, but she was naturally skeptical.
About what?
About everything. And I think that what would have normally been a natural, healthy skepticism, perhaps, there was enough out there in the atmosphere, online, on social media, to feed a natural skepticism beyond the point at which it should have been abandoned when it came to the vaccine, I think.
So you think she was misled by misinformation?
I think she was, and I think, once again, it was her choice. I don't blame anybody else for that choice, but I think there was enough out there that validated her skepticism.
And it's that skepticism that led her to not get vaccinated?
Correct, yeah.
But you didn't ask her about it?
I didn't ask her about it. I was very open about having gotten vaccinated myself. She was more of the attitude that, she was tough. She'd handled a lot of stuff in the past. I never point blank said, "You need to get vaccinated." Maybe I should have.
Do you regret that?
I do. I'm not sure, frankly, if it would have made a difference.
You don't?
I don't know if it would have made a difference, and I don't know if a mandate would have made a difference. Mom became good at a lot of things during her life, but being told what to do was never one of them.
What's been the hardest thing about the last few weeks for you?
I guess, again, I don't put her decision at anybody's feet but her own, but there is a little difficulty there reconciling. She passed, but she chose this path, and and you don't want to necessarily be angry at her, but the idea that she made that decision kind of messes with your brain a little bit.
Do you think people in power, the elected officials, do you think there should be a stronger stance taken by them? By people in your position?
I think the messaging needs to be clearer. I think there are a lot of very irresponsible people out there just helping disseminate nonsense.
So the messaging is what needs to be remedied?
The messaging is absolutely what needs to be remedied. It's not virtuous to spread misinformation. And if there's political benefit to it, it's going to keep happening. It needs to become a political liability. I think that there are those out there who know better and are saying it anyway, and then there are those who, even in positions of, even elected officials are sincere believers in the misinformation because they themselves have been deceived. But there's a good number of them that know better.
What do you want people to take away from your story, from this story of your family?
Every single thing that happened was preventable, 100%. And there's no reason to put your family through something like this, or to put your neighbors through diminished care for something that's absolutely preventable. And people need to get vaccinated.
It took less than a week from getting sick to dying. Representative Chaney says he understands how dire, he didn't understand how dire his mom's situation was at the hospital because things started to look up by mid-afternoon on Monday. But by the time he was told that he needed to be there, it was too late for him to even say goodbye to her. He told us he hasn't spoken to his sister about getting vaccinated, about her getting vaccinated, but he says he senses there might be a slight change of heart after this experience. There may also be some of you out there who are just thinking that we are stoking the flames of fear by telling you these stories. But we're merely just telling you what is happening, and that is happening a lot right now. Hospitals and their ICUs are mostly filled with unvaccinated COVID patients, and they're getting younger, and they are dying. Representative Chaney told us today when his father passed away last September, not from COVID, his funeral was scheduled for 6 days after. For his mom to arrange a service through a funeral home, they were told they were going to have to wait 3 weeks because there's so many in line.